Negative societal impact. If members become ill with COVID, to what extent would that direct compromise of society function and risk be well-being of other individuals? Meaning us healthcare workers, nurses, and doctors. That's what they're talking about. If we get infected, we can pass it on to other people. So we want to make sure that we stay healthy. Severe sickness and death due to COVID. What is the likelihood members develop severe diseases and die? That's people who are exposed directly to people who have COVID, which is who we are. Spreading disease is what is likely the member will spread COVID diseases to others. Acquiring coronavirus infection, what is the likelihood that the member will work or live in settings where they have higher probability of being exposed to COVID as described above? Now, vaccine prioritization population in phase 1, healthcare personnel at risk of exposure. That's us nurses and doctors, residents of skilled nursing and assisted living facilities and similar settings. Now, subpopulation phase 2B, type of facilities or role, location of facility, attributions of individuals, healthcare workers, additional factors affecting priority phase 3B, involving information about the COVID vaccine and avoiding unused doses, meaning we can't waste it, right? We have to make sure that we give the vaccines and we give it effectively and quickly before it expires or it's ruined. Now, up to 2 million Californians risk exposure of coronavirus through their work and healthcare of long care settings. As of December 1st, 2020, approximately 245,000 COVID cases were in these facilities. 858 COVID-19 associated deaths have been reported amongst U.S. healthcare personnel, meaning nurses and doctors, people who work in facilities, environmental workers, lab techs, x-ray techs. You're in the acute hospitals or the healthcare centers. U.S. healthcare personnel. So this group indicates individuals who work inpatient, meaning inpatient hospital settings, or outpatient hospital settings like urgent care clinics and stuff like that. Home-based community, like you go to the home to visit children, like the Department of Children and Family Services. Community-based settings providing clinical care as well as non-clinical service, like I mentioned before. Environmental services, patient transportation, interpreters, laboratory work, technicians, x-ray, etc. All staff that are in these hospitals or these locations. So it's based on members' exposure and the risk of it, okay? This group is prioritized during phase 1 because members play important roles in maintaining the capacity of California's health system and sustaining health services during the COVID-19 pandemic. Both of these with COVID and for those who need care due to other causes. So you guys are coming to us, so we have to get the vaccines first. So this is the priority that they're referring to. According to the risk of allocation criteria, members of this group tend to have higher risk. We have higher risk because we deal with you every day. That's just common sense, right? Now, any impact, like if we could have a negative satirical impact, meaning that's us, we get it and give it to you. That's not good. Now, because we have the exposure and we can get the infection. Spreading disease to others, particularly those in work in congregate settings. Congregate settings are like the skilled nurse facilities, long-term facilities, places where you live there with many, many others. Same bathrooms, you share bathrooms, you share the lounges where you eat or lunchrooms or something like that. Those are congregate settings. So residence or home-based care settings. And then also inquiring infection through contact with patients or residents who have COVID. So staff there, residents there, they come in contact, so there increases their ability to get the COVID. So they have to be vaccinated. According to the risk based on allegation criteria, members of that group tend to have high risk. Most of the time, people in skilled nursing facility or long-term care facilities, they have more higher risk because they have the comorbidities. They have already established medical condition, and they're in a congregate setting. Now, by staying healthy, members of this group, it can help others to help reduce society disruption, priority to target groups, initial phase may also help to expand access to vaccine across the world, job settings, and other settings. It may also contribute to mitigating inequalities in that racial, ethnic, minority groups and other disproportionated represented among low-wage workers in this group. There's frontline workers that are low wage, but they're frontline workers. They're essential workers. So we have to protect all groups. Residents of long-term care facilities, residents of skilled nurse facilities, and assisted livings comprise of about 1% of the population of California, but about 300 to 400,000 people. Yet they represent 6% of the state's COVID cases and 34% of COVID's death. So you can see they're at high risk. This group is also prioritized in this phase 1 because of their high risk. Because of the high risk of severe sickness, death, and older age, underlying medical conditions associated with a greater risk of hospitalization, ICU, and also being intubated and maybe eventually die. So this is what I was stating earlier, and they're at higher risk, so they have to be taken care of and given the vaccines. That's why they're in the number 1 groups, okay? So now, recommended under the B phase, subprioritization by type, facility, or role. Now, supplies are limited during this phase, so this is what we can do. Each tier, exactly, they are going to give it to the priorities. A hospitalization possible to reach priority population. Tier categories in each of these represent rank order. Persons, immunization priorities, population tiers that suffer from immunization during before the same tier 1. Acute care, psychiatric, and correctional facility hospitals. These are the first ones that are going to be. This is by facility. Skilled nurse facility, assisting living that we talked about. Similar setting, other medical vulnerable individuals. Also incorporated the Advisory Committee on Immunization Practice, the ACIP. The Committee in U.S. Center of Disease, advising guidance control vaccine. These are the people who are ongoing looking and make these recommendations. Now, residents in settings, paramedics, EMTs, and others providing emergency medical services. Dialysis center. These are life-saving centers that are care employees are exposed to other possible patients that may have COVID. Now, in tier 2, intermittent care facilities for persons who need non-continuous nursing supervision and supportive care, home care, and in-home supportive services. Those are people who come to your home to take care of you, like nurse aides. They come in, or people you choose to help assist you with your care because you can't do all your care by yourself. Community health workers, public health field staff. We go out into the field. Primary care clinics, including qualified health facilities, rural health facilities, correctional facilities, clinics, urgent care clinics. Those are the second phase that will get their vaccinations. Now, in the third tier, otherwise health settings, co-workers, including specialty clinics, laboratory workers, dental and other oral health clinics, pharmacy staff not working in settings at the higher tiers, meaning not in the hospital setting. Locations of facility, second category of sub-priorities during the phase 1, location facilities. Counties that have the highest level of certain social vulnerabilities, especially in the less urban areas, have greater risk of becoming COVID-19 in the hot spots. You hear about that on the news a lot of times. Oh, this is a hot spot. Location rapidly increasing COVID-19 incidents in the county with the lowest levels. So the higher levels, obviously, they're going to be vaccinated sooner than the lower levels because they're more at risk. Now, and this is to make sure that inequities and disparities in the social determination of health faced by vulnerable communities can increase the risk of being exposed to COVID, developing severe COVID, and promoting equality access information. Now, regarding the vulnerability of local populations and health systems to serve that can help prioritize certain geographic location. Now, this is going to always be reassessed depending on where the hot spot areas then arise. So they're going to always keep looking at this. But hopefully they'll get enough vaccines out there to where we don't have to worry about this. But just be mindful, just because you're rich and you want to get a vaccine, you're not a vulnerable situation that I mentioned, then you're going to have to wait your turn. It's not about who has money and who doesn't. It's about who's more vulnerable and who's at higher risk. Okay? When there is an inadequate dose to reach all workers in the tiers of the facility, acute care hospital doses shall be prioritized to the facility even at the greatest population of vulnerability of person in the catchment area, as measured by history of patient's illness and comparable health and death departments as far as their statistics. And this is what I'm saying. There's going to be an ongoing evaluation of what's going on in the communities and in the different states and in the world. Recommendation B3 sub-priorities are attributed to individuals, healthcare workers. Now, if there are not enough doses to reach all workers at risk in a facility, health departments, it's going to be hard for us too, right? Because it's not enough. May allocate doses to a facility if info is available to protect the workers at the higher risk of occupational exposure from COVID. Location facilities consider offering doses of vaccine to workers using who are at higher risk occupation. These are the ones for exposure to COVID in descending age in the following age groups. Remember I mentioned the older group. So 65 years and older. Then the next group will be 55 to 64 years. And then younger than 55 years after that. And then other circumstances that they deem may be significant for them to get their vaccine. Now, this is all supported by evidence, including but not limited underlying medical condition, race, and ethnicity. Now, it has to support immunization of these workers, and facilities should provide extensive information and counseling. Now, just so you know, we encourage everybody to take their vaccines. And also, don't think that once you get the vaccine, oh, I don't need a mask, I don't have to wear goggles. Well, that's not true. You still have to wear your mask because you need 2 injections. One nurse had the first injection after 10 days, and he got COVID. So you still have to protect yourself. You have to be vigilant, and you have to get at least the 2 injections, and then we'll see how research goes after that. But even after you get the 2 injections, you still need to wear your mask, social distance, wash your hands, and don't gather outside your home. Okay, so don't think, oh, I got the vaccine, I'm good. No, you still got to wear your mask because it's not proven yet. Now, there's a C tier. Additional factors affecting prioritization is the prioritization of vaccine allocation. Health departments may use additional factors related and involving the information of vaccine characteristic. Remember, we're going to make sure that if you say you have 1,000 you want to give, you have 1,000 people that's going to take it. So different facilities have to assess the people who really want the vaccine to make sure those numbers are there so the vaccine is not wasted. So that's something else that they have to also consider. Involving information on COVID-19 characteristic, vaccine characteristics that may limit the use of distributing COVID vaccine include, but not limited to. Remember, there's a storage problem with the Pfizer because it has to be stored and handled with certain requirements. So they have to be handled at sub-zero temperature. I think it was sub-zero 85. They have to stay that cold. And they can only be out, I think, out of, once they're thawed, is an hour. So, you know, they have to make sure that they're providing the right storage and the right shipping process capacity. So they have to be able to, that's why it's only certain facilities that can store these vaccines, because they have to have the proper freezers to store those vaccines. Also, when they're shipping it, they have to have the proper shipping items and to keep them that cold, minus 85. So you want to make sure that that is happening when you're distributing. So that's why another reason it could be delayed. But, you know, there's a glitch. It should have been 2 million vaccinated already. But just like anything new, there's glitches, and then you got to reorganize, and then you have to then get on board. So it's going to take us a little time. Be patient. But meantime, stay home, wear your mask, and wear your goggles. Okay, so we have to make sure that none of this is wasted because we have limited amount of doses, right? So we have to get this right. So nobody's perfect, but we got to get it as perfect as possible. Health departments may allocate doses on assumption, and then people say no, I don't want it. But we encourage everybody to take the vaccine. This is how we're going to get control of this pandemic. Also, wearing masks and goggles, washing your hands, and not gathering outside of your home. Now, after intensive and appropriate efforts are reached, they want to make sure the group is prioritized. The moment with the what's going on, the schedule for the vaccine. Health department's facility may offer vaccine promptly to person in lower priority groups. If they have extras over, then they can then go to the lower priority groups, right? If the higher groups are declining, then they can go to the next group. Demand subsides in a current group or doses are about to expire according to labeling and instruction. Health departments may temporarily adjust priority based on other resource constraints while continuing efforts to immunize higher priority groups as soon as feasible. Now, so like I said, it may change. So hopefully we'll get more doses and more out, and we can get everybody vaccinated. Promoting equality through outreach, access, and support. Promoting equality should inform strategies for prioritizing and allocating and aborting access to immunization and providing communication and outreach. It's about education. Get your vaccine. That's very important. Get your vaccine. Many persons from communities at high risk in COVID may mistrust and because what's been going on with the government, but you have to educate, and encourage everybody to get the vaccine. And that's why you're going to have nurses giving the vaccine anyway that's going to be doing education. But we got to get them before they get to the actual day of getting their doses, because those doses are allocated for people who show up to get their vaccines. So the California Vaccine Advisory Committee suggests how to engage the communities to address their concerns, provide convenient access to the vaccines. You got to make it convenient for people in order for them to come and get it, right? Some of these areas, low-income areas, don't have transportation to get to it, so they have to figure out a way. Either we're going to go to them, or some kind of way to get them to us. But we got to figure that out in our communities. Assist with messaging. Experience with vaccines is gained through California Department of Health best practice in helping for vaccine to reach members of communities with the greatest risk of COVID, to promote equity provision of COVID vaccines, health departments, and encouraging the track. Now, we even have some boo-boo the food that deliberately let vaccines spoil. I think about 75 doses. What is that about? Of course he got arrested, but we cannot lose any vaccines. And there, from what we've heard, there's an extra dose in each vial, so that's a good thing. So hopefully we'll get rid of the riffraff that are causing problems. They have had to increase security to protect the vaccine, because there's always the criminals elements out there, and then they want to get it and try to charge you more to get the vaccine. So make sure that you don't get those vaccines that are offered from anybody other than your medical providers, because those are scams. And I don't want people to get ripped off and get the wrong thing into their veins and then something happens. So make sure you stay with your medical providers, clinics, hospitals. That's the only place you should be getting a vaccine. They're eventually going to have some rolled out through CVS, Walmart, Rite Aid, different pharmacy groups. So either way it go, those are medical providers, okay, not this internet people who are trying to take advantage of all the weak. So be mindful of that. So always look for us, any healthcare provider, so you don't get ripped off, because that's what people do. They take advantage of everything. We got to try to correct all the misinformation, which is what I try to do with the shows, is to let you know not to get into the misinformation. Get tested as soon as you can. If you are exposed, or if somebody went outside your home and gathered somewhere, they need to quarantine for 14 days and they need to be tested. That's why you need to stay within your own home group, because when you go outside, you're gathering, You've lost a lot of family members, and this is really sad because we have whole families that are coming into the hospitals. So you're losing several of your family members in one whop when you can just stay home and stay safe and stay protected. So please stop doing that. You still see these youngsters out here partying. They're dying too. So kids under 2 are dying. So everybody's dying. And people become super spreaders when they don't even know they have it, and they're spreading it to their family members because they're going out and partying. So when you come back home, parents, make sure that kid is quarantined for 14 days and get tested, because it's going to spread to the whole family if not. Now, we have to increase the trust within the community. We have to include medical providers and community organizations. That's why the president and vice president, but the president-elect and vice president-elect and Dr. Fauci, and several providers are on camera showing that they're accepting the vaccine, and that you should take it. So this helps to increase the trust of the population to ensure that everybody will take heed and take the immunization. Now they're trying to rotate different staff in different locations, because sometimes after the first immunization you could get fatigue, you can get a little fever, and you can get a headache. So you want to make sure that we don't have a staffing shortage. So they're recommending that you rotate different teams so that if people do have the symptoms, then they can be out and have their symptoms and then come back. And then also with the second dose, if they don't have any symptoms in the beginning, sometimes they say with the second dose, then you can have symptoms after you get the second dose. So you have to be careful when we're doing the staffing for that. So in the meantime, what you can do to protect yourself, other things you can do is I use my Neti-Med rinse. I use that. Whenever I go out, they come with little packages, and you pour it in here with warm water, and you can rinse out your sinuses and your nose and more. That you feel so much greater. I love it. You can also take B complex. You can take melatonin at night, 10 milligrams, 6 to 10 milligrams. You can take zinc, at least 6 to 10 milligrams a day. Now, other zinc products are, orange, lemons, limes. Those are actually the acid, because COVID doesn't like high acid content. It doesn't like it at all. So the orange, the limes, and the lemons, pineapples, those are good to take to help suppress the COVID. Also, your avocados. Avocados are good acid content, as well as zinc products, zinc supplements. So also garlic is good for that. Avocados, your blackberries. And far as your berries, they do go bad fast. So if you rinse them and freeze them, you can keep them as you use them. That way they don't go fast. So get you some blackberries as well. You want to also take vitamin C, vitamin D. You want to make sure you eat the cashews and the almonds. Those are good zinc products as well. So we will be back in a few minutes, and I'll get into some easy motion exercises to help keep you healthy while you're waiting. Okay, I'll see you in a few. Alrighty. I'm going to show you some exercises you can do while you're lying, sitting, and standing. So while you're on the couch watching your favorite show, Power or whatever, you start doing some sit-ups. Okay, if you're new to this, you put your back against the arm of your couch and you can just do your sit-ups. Go down, and you can use your arms as well. Now, if you want to touch your feet, you can do that too. That's good, but if you have your stomach in the way, just go as far as you can go, and then next time, you can go down further. Always hold your ab in when you're doing any of your exercises. Hold them in, work your arms, right? And then you can slide down when you get really good and go all the way. So you're coming up, right? Working your arms, holding in your abs. So wherever you are, get to that part. Okay. Now, let's finish the lying down stuff. So, this is the rest of the lying. If you need assistance with moving, you can use your resistive band. Just put it under your heel. So you can use this to pull your foot up if you need help. Otherwise, you can do it yourself. You can do it by yourself. You can pull up. Always hold your ab in. Right? Now, you can have your feet apart and you can lift and do scissors. Right? If you can't lift, then you can do it on the ground and put one on top of the other until you get stronger, right? Then you can lift. You can do baby lifts with both, or you can do one. If it's hard for you to do both, you can do one, and then you can lift where you can go, so you can go all the way, right? And then you can do them together, little, higher, higher, so you can go all the way. You can lift all the way. Okay, and then when you get stronger, if you do it slowly, it increases resistance. So if you go all the way up, right, go slow. Hold your ab in and go slow, and it increases the resistance. So that's another thing you can work on. You can get to that. That's more advanced. To work on this inner thigh right here, right? A lot of people have that. I had it too. So just open your legs. Just open and close. Open and close. Right? That's going to work that right here. Get rid of that flab that's right there. That's good for this. Now, another thing you can do is you go to the side with one leg and go where you can go until you can go all the way. Right? Now remember, 3 sets of 10, always holding your ab. And remember, it's both sides. Both sides, okay? Now, another thing you can do is both knees. Hold your ab in, go to the side, go where you can go, so you can go all the way, right? And then you can hold it there because it stretches this out. It's good on your back, but this exercise is good for the love handles, right here. Right? And it's good for your back. If you have back pain, you can always just hold it there and it'll stretch your back out, and it actually feels really good. Okay. Now, you can do pelvic tilts. Take the palms of your hands and lift up, right? You can lift up. You can hold it, or you can do 3 sets of 10. It's either hold or do 3 sets of 10. Now, when you get more advanced, you can start with your feet, and you can stay up while your feet are sliding out until you can get all the way. That's good core right there. So practice that, but in the meantime, you can get this far. Okay? Now, let's turn on the side, and you can do leg lifts. Right? You can do, make sure you roll your hip over. You can do leg lifts, you can hold, and then you can do them towards the back and even further back. Make sure you roll your hip over, right? Both sides. Now, here's a good one. This one is for the back, that back fat and your buttocks and the back thigh. So, what you want to do is you want to raise your feet up. If you can't go all the way, go where you can go till you can go. If you have knee problems, then you have to go maybe halfway. But either way it goes, you will feel it. Okay. Now, let's do some standing. Okay, so, and it works. It actually works. I think it's work. Okay, so for standing, I want you to practice strengthening your core, meaning your abs, your buttocks, and your thighs. So I want you to get somewhere stable, and I want you to be able to hold yourself up on one leg. Try to get to 30 seconds. Now, I couldn't do it at first either, so it's going to take time, but get used to it. And you do the same thing with the other one, right? So you want to be to a point where you can hold yourself up, and then you can switch, and then you can kind of hop, move around, right? Change directions, right? But you want to get your core strong. This is the way to get your core strong, okay? Now, another thing you can do, you can do leg lifts, side, with this side part right here. It actually works on this front thigh because you're lifting up. So you can do these low, or you can go high if you want, if you can get there. And remember, it's both sides. Now, another thing you can do is toe lifts. So what you do is you go up, and it's really to the ball of your foot, right? So I used to do the baby ones when I used to brush my teeth. And if you're not used to it, you can do that, because you're still lifting and you're still activating your calf. But you want to get to the point where you can go all the way up. So you go from here to all the way up. So you want to practice that with your balance too. You got to hold on until you can get it, until you get stronger. But that's good for those calves. And you can do that while you brush your teeth. Okay? Now, one more thing while you're standing is squats. So if you have knee problems, then you want to make sure that your legs are apart, but you want to put yourself in a sitting position. You want to stick your butt out. So if you have knee problems, you want to stick out. See how that movement pushes you off of your knees? So you want to do that to squat. If you don't have any problems, then you can just squat. But if you have knee problems, you want to stick your butt out and squat. Okay. All right. So that's for standing. Now, also, you can do marches, right? Lifts, and you work in your arms. If you don't have the weights, no sweat. You can get bottled water. You can get canned vegetables, whatever, as long as you have some weights, right? So it doesn't really matter. So you can do all those things, okay? So it's no excuse. Another thing you can do is, this is like the standing sit-up. Okay, so you open your legs apart, and you're going to go down and touch. Now, if you can't go all the way down, go to your knees, and then if not, go to your ankles or your calves, or then go to the top of your feet, and eventually to the floor, right? This is also a good way to warm down at the end, because it stretches out your back. So these are what you can do. Now, if you have back problems, you want to do it slowly, because otherwise you get back spasms. So you want to go slowly, wherever you can go. But then you want to go to the side. right? To the side. But you don't want to twist. That's a different exercise. You can do twisties later, but you don't want to twist with this one. So you can mix it up, front, go to the side, right? So you have several ways to work on your core right there. Now, let's do some exercises while we're sitting down. So, while you're sitting, let's go back to the sitting sit-up, right? No matter what, lying, standing, or sitting, you can work on this core. So, you're going to do the same thing. You can go down to the floor, right? To the floor, right? Do the same thing. And then you can also add your weights, add your pins, add your water bottles to work those arms. Because the more you can work at one time, the better it is, right? Now, you can also do the same issue for the inner thigh. You can do that while you're sitting. So, you just open and close the same way while you're sitting. It's still the same movement. It's still going to be this inner thigh right here. So you just open and you just close, right? Now, some things you can do for your arms, you know, for that big arm whack, right? You can get two bands. You get one band tied in the middle, put one on your knee, and then just do some curls. If you want to put more pressure, then straighten it out more. Put your hand on the outside of your knee and do your curls on the outside of your leg to get more resistance. You can do that. And then you switch and you can do the same thing. It just depends on where you are and what you want to do. Now, if you haven't used your muscles in a while, then you're going to feel this, so don't think you won't. You will feel it. Now, another thing you can do, you can do the scissors, right, while you're sitting. You can do the scissors. You can do the 3-point lift, right? Because you're going up, you're going out, and you're bending, and you're going back down. You can do that, right? You can also do, you can do one leg lifts, right? Do one leg lift. Wherever you can go. If you can't go all the way, then you go where you can go. 3 sets of 10s. Always hold your abs in, no matter what you're doing. Okay, if you can do a little bit more, fine. That's great. And then add more reps as you go along. Now, another thing you can do is you can do both lifts for both your feet, right? So make sure your back is all the way back in your chair. You don't want to use your back. You want to use your core and your legs. So you can lift a little bit off the ground, depending on where you are, and then you can get higher and higher, right? So you have to get stronger for that. But you can do that. You can do individuals, right? You can do little babies when you get stronger, and then you can go higher when you get stronger. Always holding your abs when you're doing it, right? Okay, so you can also do what I call toe marches, where you're lifting up your toes, right? And then individual. Then you can do them together, right? And you can work your arms at the same time. A lot of these exercises, you can work your arms at the same time, which is good because you want to work 2 things at once, at least, right? So you got upper and lower going at the same time. Now, another thing you can do for your arms, if you don't have shoulder restriction, I do, so I can't have my arms up too high. But you can raise it up here, and then you can work it this way. And that gets the back of your arm, right? So there's a lot of different things you can do with that. Now, I'm going to introduce you to another great thing you can do. If you guys are following my show, I've told you about I had got my new QB. Now, the great thing about QB is it has a resistant dial you can adjust. And it has a speedometer. It tells you how many calories. It tells you how many steps you did. And all you got to do is put your feet here and just get the pedaling. And while you're watching your favorite show. So after 3 or 4 commercials, depends on the show, determines how many commercials it is. Then you can do a half hour. And if you do the whole show, you're doing it for the whole hour. And then you can speed it up, or you can turn up your resistance if that's what you want. So it's great. It supports your feet. Everything's supported. And trust me, you feel it after you're done. I always do this for at least an hour while I'm watching TV. It's my favorite program. So this is what I do every night too, on top of the other exercises. And you got to rotate it up. And don't get crazy if you start to weigh more, because muscle weighs more than fat. So you only want to weigh yourself once. Do it in the morning and after you empty your bladder on the floor, not on the carpet. The most important things is inches. You'll start seeing clothes is getting looser on you. You have to maybe get different sizes. That's a good thing. That's a real good thing. But what's important right now is that you guys stay healthy. No matter if you get the first round of the vaccine or you get the second round of the vaccine, you still got to wear your mask. You have to wear your mask. Now, what I do want to tell you is some people don't wear their mask properly. And I don't know why. We've been doing this for a long time. In order to wear a proper mask, you have to cover your mouth and you got to cover your nose. Mouth, nose. So, I see people wearing their masks like this. You're not helping yourself. You can still breathe it in and exhale. No. And then you have people wearing it down here under the chin. Right? That is definitely not going to help you. What is that helping? It's not helping anything. So that's the wrong way to wear your mask. You have to wear your mask so it covers your mouth and your nose. That's the way you wear your mask. It's the only way. And then I see people that do this. For what? You can still hear you through the mask. People think, oh, I'm talking, so, I think I'm going to take my mask off. But no, you don't need to do that. You can still hear me through my mask. So I don't know why people do that, but this is the right way to wear a mask. Now, I also have my goggles that I told you guys about. You can't see any holes in there. That's what you don't want. You don't want the goggles that have holes, which is called vented. You don't want those. You want indirect or non-vented. These sit over my eyes and protect it. So you know the coronavirus, it comes in through your eyes as well as your nose and your mouth. So you just get you some from Amazon.com. Fog free, and it even fits over your glasses. You can get those kinds too. Also, I get fog free spray, and I keep spraying it, and it gets better and better and better. So you can get these things to protect yourself. Now, the other thing is protecting yourself is making sure. Get some water. Making sure you're not overeating. Half of your plate should be fruits and vegetables. Half of your plate should be fruits and vegetables. Not the complex carbohydrates like rice and potatoes and pasta and all that. That should only be 1/6. 1/6. And then 1/4 should be lean protein. Turkey, chicken, fish, any type of tuna. Any type of fish is always good for you. And you want to stay away from fried stuff as much as possible, because that's adding extra calories to that. You want to make sure if you're overweight, then drink a glass of water first. A whole glass of water. Eat slowly, because it's proof that if you eat too fast, you're eating 3 to 4 times more than you should be eating. It takes time for the brain to tell the stomach it's full. So eat slowly. Sit with your children while they eat, because children always eat too fast. Always eat too fast. So then that's why people wind up miserable after they eat, because they ate too much, because they ate too fast. So slow down. Sit with your children while they eat so you can help slow them down as well. Now, don't forget to make sure that you make some lemonade or eat lemons. But don't put a bunch of sugar in it. Okay. Lemons, orange, limes, pineapples, avocados are all acid-based foods. The coronavirus don't like it. So these are things that you can add to your diet to assist you with that. Also, you want to keep your immune system. You want to keep building your immune system. Your avocados are good for acid and immune. So avocado is just a great vegetable to have around. Also, broccoli, garlic. If you don't want to eat garlic every day, then there's garlic supplement tablets. Also, blackberries are very good in immune, in zinc, as well as almonds, right? Who knew almonds and cashews will be a great thing to help your immune? It's very good with that. So you can get you some almonds and cashews to help you with that, as well as you want to take your vitamin C, you want to take vitamin D, and usually D comes with calcium, and as long as you get 1,000 IUs, then you're good to go. 1,000 of milligrams of vitamin C, you're good to go. Zinc, anywhere from 6 to 10. Melatonin is another one that they're recommending to take, but you take this at night. Take it an hour before you go to sleep. Or if you're having problems sleeping too as well, I used to teach this on some of my earlier shows. If you can't sleep, you take your melatonin an hour before you plan on going to sleep, and you sleep. So it's also good for the coronavirus. So talk to your doctor to make sure it's okay for you to take it every day. But it shouldn't be a problem. Also, B complex, you take that every day as well. And then also, make sure you clean in all your items that come in from your mail. Make sure you're washing your hands, you're cleaning your packages. You can get an antibacterial soap and a towel, soap it up and rub everything down. As far as Clorox sprays and stuff like that, get you some bottles on the internet. Get you a jug of bleach. You do 1/3 bleach and the rest water, and you got a disinfectant spray. Instead of wasting your money on buying the wipes and all this other stuff, you have it. Now my husband, he does a antibacterial soap and puts it in a sandwich bag to take it with him so he can wipe his hands as he's out. There's different ways you can do things, but the coronavirus does sit on different objects. Another good thing is to gargle in the morning. Like when you're brushing your teeth, cough a little bit and then gargle, because mucus tends to set in the back of our throats when we sleep. So gargling with mouthwash is a good thing. They have some research that proved that gargling with mouthwash does help to kill some of the coronavirus. So just so you know, that's a good thing, good habit to do as well. And then make sure that you're washing your hand. If you're out and about, take your waterless soap, because you want to have at least 60% or higher. So when you take off your gloves, wash your hands before you touch your mask and before you touch your goggles. Always wash your hands before and after. So you want to make sure your hands are clean. You don't want to touch your face while you're out and about, because the coronavirus does enter into the eye, especially right here as well. So it enters into the eye, it enters into the nose and the mouth. So, and then there may be people who are asymptomatic, meaning no symptoms at all, but they have COVID. Those are the super spreaders. They have the COVID and they don't know they have it. So you want to make sure you always wear your mask. Don't wear it below your nose. Definitely don't wear it under your chin. not helping you. You have to wear it. So you have the right to tell people who are too close to stand back, cover their nose, because that's not helping them or you. So if you want to reach me, you can reach me at healthyliving.company. There's my website. I have certain items, products. You can go there, but if it's gumbo and egg toast, you have to send me a message or send me a message here at the Next Level Studio. There's previous shows there. You just click on the previous show link. You can have your family and friends watch it. You can have them do the exercises. Stay healthy. Don't gain weight. Lose weight. Because obesity is a big factor for complications with COVID. So you want to lose weight, not gain weight. Also, the producer of the show is T-Jams, T-J-A-M-Z. And you can reach him at tjamsmusic.com. There he has a list of songs. He does web designs. You can send him messages. Or you can contact him here at the Next Level Studios at 310-549-1113. 310-549-1113. So I'll probably be doing the show in a couple of weeks. So I will see you in a couple of weeks. Wear your mask and goggles. Stay more than 6 feet apart. Wash your hands. And get your vaccines. Okay? See you in a couple of weeks. Bye-bye. We're going to try to stay on the schedule where we're going to do the show every first and third Sunday. So I'm going to do my best to stay on track for the first and third week of the month. Okay? Alrighty, so until then, stay safe, eat healthy, get your supplements, wear your mask. Bye-bye. Exercise. Bye-bye.